That human pain pill can poison your pet before the limp ever gets better. If your hand is already near the bottle, stop there and check one safer pain clue first. I mean the dog who hops off the couch, lands wrong, and comes up limping. Or the cat crouched under the kitchen table with a tight little back and quiet eyes. Your chest jumps. You want relief now. So your mind goes to ibuprofen, acetaminophen, naproxen, or aspirin. Here is the reversal. The pill may be more dangerous than the limp. Before you try the obvious fix, you need to understand why pets hide pain and why human pills are such an easy trap. I'm Dr. Maya Hart, and I've spent more than 2 decades in exam rooms with families who were trying to help. They gave one small pill, half a tablet, a baby dose, something they had used safely for a sore knee or a headache. Then their dog vomited, stopped eating, passed black stool, or their cat became dull and turned away from the food bowl. I'm not here to judge you. Panic makes good people reach for familiar things. The medicine bottle feels like doing something, and watching a pet hurt can feel unbearable. But pets do not handle many human pain relievers the way we do. The wrong choice can turn a sore leg into kidney failure, liver injury, stomach ulcers, or poisoning. So we are going to make this simple. First, we draw the medicine safety line. Then we talk about what not to give. Then we document the pain signs your veterinarian actually needs. After that, I'll give you the vet-safe replacement clue that tells you when home rest is reasonable for the moment, and when veterinary guidance is not optional. This mistake happens for one simple reason. Animals do not show pain the way people expect. A person with a sore ankle points to it. A dog may still wag. A cat may just disappear under the bed. In nature, showing weakness can make an animal vulnerable, so dogs and cats often cover pain until it is hard to miss. That matters. Pain may look like a limp, but it may also look like a hunched back, trembling, hiding, panting, refusing stairs, licking one spot, skipping dinner, guarding the belly, or standing with the head low and the tail tucked. A dog who still walks on a sore leg is not automatically fine. Many dogs keep moving because they want to, follow you to the kitchen, go outside, or avoid being left behind. Cats are even trickier. A painful cat may stop jumping onto the bed, sit in a loaf position with tense shoulders, squint, growl when picked up, miss the litter box, or eat a few bites and walk away. Some cats look quiet instead of dramatic. Quiet can be the clue. Here is the first mini payoff before we talk about any medicine. Take a 20-second phone video before you touch the bottle. Film your dog walking from the side, then from the front, on a flat, non-slippery floor. For a cat, film the posture, the walk if they will move, and how they rise from lying down. Do not chase the cat around the room for footage. Let the video show what is real. That short video often tells your regular vet more than the sentence, "She's limping." It can show which leg is affected, whether the toes touch the floor, whether the back is arched, whether your pet is wobbly, and whether breathing looks normal. If you need to call an ER vet, that video can help them judge how urgent the situation sounds. Dogs and cats are not small humans in fur coats. Cats metabolize many drugs differently than dogs and people. Their liver pathways are limited for certain medications, so a dose that sounds tiny to a person can be dangerous in a cat's body. Dogs have their own risks, especially with the stomach lining and kidneys. A pill that helped your back pain can injure your pet before anyone even understands the original pain. That is how the common fix backfires before the real problem is clear. Let's make this simple. When you see pain, use this order: stop, separate, observe, document, call. Stop all human pain pills. Not one dose to take the edge off. Not a leftover tablet from your bathroom cabinet. Not a pill you used for another pet years ago. If your veterinarian has not prescribed that exact medication for this exact pet with an exact dose and timing, do not give it. Separate your pet from the things that make pain worse. Move the dog away from stairs, couch jumping, rough play, and slick floors. Close the bedroom door if the bed is the launch pad. Use a leash for potty breaks, even in a fenced yard, because a sore dog can still sprint after a squirrel and make an injury worse. For a cat, think quiet and contained. A small room with a bed, water bowl, food bowl, and litter box nearby is often safer than the whole house. Do not force a painful cat out from under furniture with your hands near the mouth. Use a calm voice. Give space. If the cat must be moved, use a carrier with a towel and slow movements. Now observe. Look at gait. Does one paw barely touch? Is the back hunched? Is breathing calm, or is your pet panting at rest? Was dinner ignored? Are the gums pink or pale? Has your pet urinated? Any diarrhea, constipation, or black stool? Can your pet rise without crying or collapsing? Document what you see. One short video from the side. One from the front if your pet can safely walk a few steps. Write down when the pain began, what happened right before it, and what body part seems involved. Jumped off couch at 6 p.m. Right front limp, toe touching only. Ate dinner, drinking water, gums pink, no medication given. Is useful. It is calm, concrete, and fast. Comfort support is allowed. A quiet room is allowed. Soft bedding is allowed. Normal water access is allowed. Leash-only potty breaks for dogs are allowed. Carrier-safe rest for cats is allowed. What is not allowed is turning your living room into a test track. Do not make your dog walk back and forth to, quote-unquote, see if it gets better. Do not bend the leg over and over. Do not press hard on a swollen area to prove a point. Before you try it, check this first. Comfort support should lower stress, not hide worsening signs. If your pet is crying, collapsing, dragging a limb, breathing hard, or cannot stand, that is not a wait and watch situation. Once the pet is stable and observed, the next danger is the bathroom cabinet medicine that looks harmless. Here's the line I don't want you to cross. Do not give ibuprofen, naproxen, acetaminophen, aspirin, or combination cold and sleep products to a dog or cat unless a veterinarian has specifically prescribed that exact drug for that exact animal. Ibuprofen is common in homes. Naproxen may be sitting right beside it. Acetaminophen may be in a pain reliever or mixed into a cold product. Aspirin may look old-fashioned and mild. Combination products are especially risky because one tablet or liquid can hide several active ingredients on the label. Your pet does not care that it came from a familiar brand or a tiny bottle. Their liver, kidneys, stomach, and red blood cells still have to handle the chemistry. In dogs, some human pain relievers can damage the stomach lining. That can mean vomiting, loss of appetite, belly pain, ulcers, vomiting blood, or black tar-like stool. Some can injure the kidneys, especially if a dog is older, dehydrated, already sick, or taking other medication. Acetaminophen can injure the liver and affect oxygen-carrying blood cells. In cats, the danger line is tighter. Common pain pills can poison cats at doses owners assume are tiny. A cat who swallows acetaminophen can become severely ill because cats cannot process it safely the way people do. You may see drooling, swelling of the face or paws, trouble breathing, brownish gums, weakness, or collapse. But you should not wait for those signs. Baby aspirin is not a safety rule. Just half is not a safety rule. They had it before is not a safety rule. A pet's weight, age, hydration, kidney function, liver function, other medications, and species all matter. The safe rule is a veterinary prescription with exact instructions. Once that line is clear, the real title payoff makes sense. The safe clue is not in the bottle. The vet safe replacement is what I call the comfort function clue. When your pet is in pain, do not ask, "What pill can I give?" Ask this instead. Can my pet comfortably do the 5 basics? Can they get up, walk, eat or drink, rest, and go potty? That one question changes the whole decision. It moves you away from guessing a dose and toward reading function, which is what veterinarians care about when we triage pain. Can your pet get up? Watch the first movement from lying down. A dog who slowly stands and then walks with a mild limp is different from a dog who cannot rise without crying. A cat who chooses not to jump but can stand and walk to the bowl is different from a cat who stays hunched in one spot and resists moving. Can your pet walk? For dogs, look for weight bearing. If the paw touches the floor and the limp is mild, you still call your vet for guidance, but you have useful information. If the dog cannot bear weight, holds the leg completely up, knuckles the paw, drags the toes, or suddenly develops a severe limp, call promptly. If there is a swollen limb, an obvious angle, a dangling leg, or pain after a fall or car accident, do not treat that as home care trouble. Can your pet eat or drink? Pain often changes appetite. A dog who skips one meal after an injury needs attention, especially if other signs are present. A cat not eating is a bigger warning. Cats can get into metabolic trouble when they stop eating, and pain is one reason they shut down. If your cat is painful and not eating, call your veterinarian. Can your pet rest? This is the clue many owners miss. A painful pet may not sleep. They may stand, lie down, stand again, pace, pant, stare, or keep changing positions. Panting at rest in a dog, especially when the room is not hot, can be a pain sign. A cat may crouch with the belly tucked, tail low, eyes narrowed, and body tense. If your pet cannot settle, that matters. Can your pet go potty? A dog who cannot posture to urinate or defecate needs help. A cat who avoids the litter box, cries in the box, strains, or produces no urine needs urgent veterinary guidance. Trouble urinating in cats can be life-threatening, especially in male cats. Do not assume it is back pain or behavior. Now put the clue into one clear report. This began at 7 p.m. after jumping off the couch. It is the left rear leg. He is not bearing weight. He is still drinking. Gums are pink. Breathing is normal. No human medication given. That sentence is far more useful than, "He seems hurt." It helps the clinic triage. For a cat, you might say, "She has been hiding under the table since this afternoon. She is hunched, growled when picked up, did not eat dinner, used the litter box once this morning, and no medication was given." That tells your veterinarian the pain has affected function, not just mood. This is home care safe only if the signs are mild. Your pet can still do the basics, there is no known trauma, breathing is normal, gums are pink, and you have veterinary guidance if the pain persists or worsens. The comfort function clue does not replace your vet. It tells you what to notice before you call, and it keeps you away from the bottle that can poison your pet. That clue helps tonight, but pain safety also depends on what you do during the next 12 to 24 hours. Make a short pain log. Keep it plain. Time, movement, appetite, water, potty, breathing, behavior, and swelling. You do not need a fancy chart. A note on your phone works. At 8 p.m., mild right front limp, ate half dinner, drinking, breathing normal. At 10 p.m., still limping, rested, no vomiting. At 7 a.m., worse when rising, no breakfast. That pattern matters. Improvement should be steady. It should not be better after resting, then worse every time they move. That rebound pattern can mean the tissue is being irritated again and again. A sprain, torn nail, sore back, paw injury, joint flare, or ligament problem can all look different once the pet moves. Rest needs structure. For dogs, block stairs when possible. Use a harness for support if your dog is wobbly, but do not lift by the collar. Keep leash walks short and boring. Potty, then back inside. No fetch. No wrestling with another dog. No jumping into the car. If your dog sleeps on the couch, use a gate, a closed door, or a bed on the floor tonight. For cats, make the world smaller. Put food, water, bedding, and a low-entry litter box nearby. A storage bin lid with litter, a shallow tray, or a low-sided box can help a sore cat avoid a high step. Do not place the resting area on a tall bed or laundry room shelf. Painful cats still try to reach favorite spots, and landing can worsen the injury. Clean up the environment. Lay rugs or yoga mats over slick floors. Move toys that trigger rough play. Block couch access. Separate pets who chase or wrestle. If you have an older dog with weak hips, use a towel under the belly only as gentle support for a few steps, not as a way to drag them along. Cost-conscious care does not mean delayed care. Good documentation can help your regular vet decide whether you need the next available appointment, same-day care, or an ER visit. It may prevent a panicked ER trip when the signs are mild and improving. But it must never be used to talk yourself out of care when red flags appear. Pain is information. Your job is not to silence it with a random pill. Your job is to protect your pet from making it worse, keep notes that make sense, and contact the right medical help when function fails. Home care is useful only until these signs appear. Do not give human pain medication unless a veterinarian has specifically prescribed that exact drug, exact dose, exact timing, and exact pet. If any human pain pill is swallowed, call your veterinarian, an ER clinic, or animal poison control immediately, even if your pet looks normal. Some toxic effects are delayed, and waiting for a pet to look sick can cost precious treatment time. Go urgently if you see collapse, pale gums, labored breathing, repeated vomiting, vomiting blood, black stool, a swollen belly, crying that will not settle, paralysis, dragging limbs, inability to stand, an open wound, a suspected fracture, an eye injury, toxin exposure, pain after a car accident, or pain after a significant fall. For cats, add this hard boundary. A painful cat who is not eating needs veterinary guidance. A cat straining in the litter box, producing little or no urine, crying in the box, or hiding with a tense belly should not wait. Dog advice is not cat advice. A medication plan that was safe for one dog can be dangerous for a cat, and a dose from years ago may be wrong today. The safest pet parent is not the one who guesses fastest. It is the one who stops the dangerous step first. So picture that limping dog beside the couch, or that hunched cat under the table. You do not need to prove your love by reaching into the medicine cabinet. You protect them by drawing the safety line. No human pain pills without a veterinarian's exact prescription. Document the pain clues. Use the comfort function clue. And call when they fail a basic function or any red flag appears. If you are watching because this is happening in your house right now, take the video, write the short note, keep your pet quiet and call for guidance. Say what you saw. Say what changed. Say clearly that no human medication was given, or say exactly what was swallowed if it happened. That honesty helps your pet. In the comments, tell me dog or cat, their age, their name, and the pain clue you noticed first. Limping, hunching, hiding, panting, appetite change, or trouble rising. And share this with a pet parent who keeps human pain relievers at home, because one stopped pill can prevent a heartbreaking mistake. Give your dog or cat a gentle moment of comfort from Dr. Maya tonight, and check that one safety line before you try anything new.